Well, our consortium is a consortium of a diverse number of researchers. We have multiple disciplines, from experienced marine mammal biologists to veterinarians and toxicologists and immunologists and modelers and statisticians. And many of us have been working together since the oil spill to try to understand how the exposure to the oil and the oil spill would affect marine mammal populations in the Gulf. And so we've learned a lot since the DWH spill. Before the spill, very little was known about how oil exposure would affect dolphins and whales. And so we've learned an incredible amount since the spill about the pathways for exposure, the routes of exposure, and how the exposure affects the health of marine mammals. But while we've come a long way scientifically since the spill, there's still a number of lingering questions, and that was what CARMMHA, or the Consortium for the Advanced Research on Marine Mammal Health Assessments, that was the reason we formed CARMMHA, was to investigate some of these lingering questions and address and try to get answers to these questions. Well, our early research just after the spill found that marine mammals, dolphins and whales in the Gulf can be exposed to oil not only through incidental ingestion, but also through inhalation and aspiration. And these exposures can lead to lung disease, can lead to effects on the neuroendocrine system, so it affects an animal's stress response. We found really low levels of some stress hormones in dolphins, and these hormones are essential for a wild animal to manage day-to-day stressors. So that was some of our early research. Through the CARMMHA research, what we're finding is that many of these health effects are long-lasting. Some things like the neuroendocrine effects seem to be resolving, but others like the lung disease and effects on the immune system and inflammation are becoming chronic conditions, and they're lasting for a really long time. Some of our most recent discoveries was that we're seeing evidence of cardiac effects in marine mammals as well. We're finding a high prevalence of arrhythmias and an increased thickness in the wall of the heart in dolphins in areas that have been exposed to high levels of the oil. And we don't see this in dolphins from areas that weren't exposed to the oil. And this is really interesting because many of the other GoMRI researchers are finding cardiac effects in other species as well. So we've now pulled in 2 cardiologists onto our team to try to better investigate these cardiac effects and understand, are they related to the oil or other stressors in the environment. Okay, well, our findings are basically telling us that it's complicated. There's just no easy way to undo the damage that's caused by an oil spill, particularly when you're talking about long-lived and slow-reproducing animals like marine mammals. So through our modeling that we've done with our team and incorporating the health data that we've gotten through our research, we're looking at how these health impacts are going to affect populations over time. And unfortunately, what we're finding is that these impacts are going to last for decades in marine mammals in the Gulf of Mexico. Well, there's a number of stressors in the Gulf of Mexico for marine mammal populations. There's fishing activities, there's energy exploration and shipping and the noise that causes. There's drilling and other oil spills. And in some of the coastal regions, there's also fluctuations in salinity that can impact the health of coastal marine mammals. And these fluctuations may become even more extreme as we're starting to do restoration activities and trying to rebuild wetlands through diversion of rivers. So while all this is going on, we're also looking at the effects from the oil spill, and we're finding that these effects are long-lasting and they're continuing to impact the health of marine mammals. So our research is basically helping to understand how these different stressors may be interacting and cumulatively affecting populations, and basically then help us to define the best restoration activities and adapt our restoration activities over time to make sure that they're actually benefiting the marine mammal populations that we're trying to restore. I think our research has also, over the long term, helped to identify vulnerabilities and vulnerable marine mammal species and populations, and that knowledge helps us be better prepared for the next spill.